Hey, I wanted to take a few minutes to discuss the paper, Health Policy Affecting Nursing Care. Please do not overthink this paper. Take it step by step, or in this case, item by item. You do not need to have a policy to complete this paper. So what do you need? You need a topic. And how are you going to choose the topic? Are there any topics that you've use for quality improvement or your nurse residency program or any of the previous classes that you've had? Is there anything frustrating on your unit? There are also some case studies in the textbook with topics that might be of interest to you. You can also go to your professional nursing organization, see if they have any topics that they're advocating, and do any of those interest you. Explain why you chose the topic. What considerations are you going to use to determine patient population? Will it be a disease process, age, cultural differences, language barriers, literacy? And after you choose a topic, who are you going to want on your team? If you have completed Nursing 443, Evidence-Based Practice and Research in Nursing, you know how to choose your stakeholders and your team members from the PET steps 1 through 20. Do you need an interdisciplinary team, and who would be on that team? Would it include respiratory therapy, pharmacy, physicians, case managers, discharge planners, navigators? And then the next section's advocates. Who's going to be your advocate? And you can have more than one. Will it be nursing administration? In other words, your nurse manager, your director, your executive vice president. Would you need to have an advocate in the business world? Do you have a patient advocate in your facility? And is there a patient advocate team of former patients and families? And if it's a legal issue, would you want a legal advocate or a risk manager? Then how would you take this to another level? Would you start small on your unit and expand throughout the hospital? Would you take it to your professional organization, the local chapter, the state chapter, the national chapter? Would you meet with your city representatives, or would you bring it to the attention of your representatives in Richmond or DC? And then, what steps would you take to redefine what you've done? What outcomes are you going to look at? Will you change the patient population? Will you be changing staffing? Will you be changing your interdisciplinary team or your stakeholders? Then remember, the paper needs to be at least 6 to 8 pages. When you include the title and reference page, is going to be at least 8 to 10 pages. The references must include your textbook. And remember, you need to have at least 6 of them. Not 6 textbooks, mind you, but 6 scholarly references, and one of those needs to be the textbook. Remember that the textbook is the 3rd edition, Policy and Politics for Nurses and Other Health Professionals, Advocacy and Action. And let's take a real quick look at the rubric, just so that you have it. 40 points is on your content. Make sure it's very clear. 20 points is for your introduction. Tell me what your paper is going to be about. Tell me what your topic is. Tell me why you chose it. The organization and use of headings, I know I say this a lot, but if it were me, I would use the assignment to guide me on my headings. So obviously you have the introduction, you're choosing one of the healthcare topics, you're identifying how you're going to make a policy difference, who the groups will be for your advocates, what are you expecting to happen with political government involvement or interference, and how are you redefining the policy. That is how I would organize my paper. Obviously, spelling, grammar, punctuation is important, APA format. And then finally, the conclusion is worth 20 points. Remember, a conclusion tells me what you have talked about in your paper, what you wanted me to understand from what you've just written. And it should say conclusion, not in summary, not summary. It should say conclusion. I hope this has been helpful to you. If you need me, please reach out, and I wish you the best of luck. I am really looking forward to reading your papers.